Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Dear colleagues and PGs, today we shall discuss Aphthous ulcers. You know the Aphthous ulcers, it's a common condition which patients present to us in our OPDs, in GI practice as well as in medical practice. So we shall discuss today the types of Aphthous ulcers, the causes of Aphthous ulcers, and how to deal with these. By and large, these are benign but really troublesome to the patients. And that's the reason the patients who develop Aphthous ulcers again and again, they become frustrated. They go from doctor to doctor. They use their home remedies, and even some of them, they really go into severe depression. So all these will be discussed today in our today's lecture. So as I said that the topic for today's discussion is Aphthous ulcers. This is the one of the most common conditions which the patients present to us. In today's lecture, we shall discuss what are the Aphthous ulcers, what are these, what are the types of Aphthous ulcers, what are the symptoms of Aphthous ulcers, what are the signs of Aphthous ulcers, how we differentiate it from the malignant ulcers, what are the causes of Aphthous ulcers, and then we will discuss how we diagnose that the ulcer is really an Aphthous ulcer, not a malignant one, and what are the complications of Aphthous ulcers, and what's the treatment of Aphthous ulcers, and how we can prevent the occurrence of Aphthous ulcers, and what's the prognosis of the Aphthous ulcers. So we shall discuss all these aspects in today's lecture. So what are the Aphthous ulcers? These are the common presentations which we come across in our clinical practice. The Aphthous mouth ulcers are a common variety of ulcer that form on the mucous membranes, typically in the oral cavity or mouth. Other names for Aphthous ulcers include Aphthous stomatitis and canker sores. Aphthous ulcers are generally round in shape and form in the soft areas of the mouth, such as the inside of the lips, the cheeks, or underside of the tongue, like here. They are benign, non-contagious, and can occur as single ulcer or in clusters. We all know that it may be a single Aphthous ulcer, or there may be many of these. In most instances, Aphthous ulcers are recurrent, a condition known as recurrent Aphthous stomatitis or RAS, with each episode normally lasting for between 7 and 10 days. The cause of the condition is unclear and there is no cure, but treatment options are available to treat the pain the ulcers can cause. We all know this. There are three main types of Aphthous ulcers. The minor Aphthous ulcers. These are the most common variety. They are small in size, usually less than 5 millimeter in diameter, and can form as a single ulcer or in a cluster. So it can be a single ulcer or it may be clusters. Like here, it's a single ulcer, and here there are 3 ulcers. They typically do not cause much pain. Then the other type is the major Aphthous ulcers. These are less common as compared to the minor Aphthous ulcers. They are generally 5 mm or larger and form singularly or in a pair. So they may be in a single or they may come in pair. They can be painful, especially when eating or drinking, and last anywhere between 2 weeks and a number of months. So the minor Aphthous ulcers, they last shorter, and the major Aphthous ulcers, they last longer. Then the third variety is herpetiform ulcers. These can occur when multiple pinpoint lesions fuse together and form large, irregularly shaped ulcers. Herpetiform ulcers are so called because of their similarity in appearance to herpes. However, herpetiform ulceration is not caused by the herpes simplex virus. So they are they mimic the herpes ulcers, but they are not the herpes ulcers. Herpetiform ulcers, these can occur when multiple pinpoint lesions fuse together. We saw this. Aside from the ulcers, what are the symptoms? Themselves, the condition has very few symptoms. We all know that. Before ulceration occurs, some individuals may be benign to feel a burning or itching sensation inside the mouth, which can be painful. So they say that we started having burning sensation or itching sensation inside our mouth, and then these were followed by the ulcers. Once the ulceration occurs, localized pain of various degrees is often present. The ulcers are normally shallow and begin as pale yellow in color, generally turning gray as the condition develops. So initially they are small, they are shallow and pale yellow in color, but later on they become deep. They may be ringed with red or appear fully red when inflamed, depending upon what condition, in what state they are. Depending on where the ulcers are located, eating, drinking, and talking may become uncomfortable. What are the causes of Aphthous ulcers? We all know the mouth, dental braces, sensitivity to acidic foods such as lime, pineapple, or strawberry, mouth wound, which is caused by the tooth brushing and accidental biting of tip, viral or fungal infection can cause mouth ulcers, and lack of vitamins, especially vitamin B12, folate, and iron can cause mouth ulcers. But the precise cause we know are the causes of Aphthous ulcers are unknown. However, it is thought that ulceration is brought about by one or a combination of external triggers. We all know that. It may also be partly genetic, with 40% of the people who experience ulcers having a family history of the condition. So this is another predisposition, genetic predisposition towards Aphthous ulcers development. Aphthous mouth ulcers affect around 1 in 5 people, at least occasionally. This is what they are, and most commonly begin to appear between the ages of 10 and 19. That is the reason I said it's a very common condition we come across. Possible triggers of Aphthous ulcers include emotional stress, minor injury to the inside of the mouth, for example, from cuts, burns, are bites while eating, dental work, hard brushing, or ill-fitting dentures. And I said before, there may be familial tendency. Sodium lauryl sulfate, it's an active ingredient in some toothpastes and mouthwashes. This compound is not proven as a trigger, but is known to prolong the time needed for ulcers to heal. So this is one of the association of this. Certain food and drinks, including coffee, chocolate, eggs and cheese, as well as acidic or spicy foods, they are associated with development of Aphthous ulcers. A deficiency of certain vitamins and or minerals, including zinc, B12, folate, and iron, that may present with anemia, they are associated with development of Aphthous ulcers. An allergic reaction to oral bacteria is another cause. Using as well as quitting the use of tobacco products again is associated with Aphthous ulcers. Then hormonal changes associated with pregnancy. Having a weakened immune system due to certain chronic conditions like immune deficiency. Then stress is a common cause of mouth ulcers. We see the young boys and girls coming to us with the Aphthous ulcers during their exams or some other stress in their school and colleges. Although stress does not directly cause mouth ulcers, it does increase the chances of developing them and can affect their healing process. We all know that. Mouth ulcers can also cause stress by affecting how and what the affected person can eat and drink. Then some medications are also linked to the development of ulcers. However, they may not always cause the Aphthous variety of ulcers. These drugs include nicorandil, a drug used to treat angina pectoris or heart condition, ibuprofen and other anti-inflammatory medications, oral nicotine replacement therapy opposed to page replacement therapy, and medicines such as aspirin if left to dissolve in the mouth instead of being swallowed, and illegal drugs like cocaine. All these are associated with development of Aphthous ulcers. Very rarely, recurrent ulcerations can be a possible sign of several serious diseases like Crohn's disease. We all know the ulcers of the Crohn's may start from the oral cavity. Celiac disease, Behçet disease, where there are ulcers at the genital ulcers, there are bilateral uveitis, systemic vasculitis, there may be bloody diarrhea, and there may be oral ulcers. And HIV, AIDS, among different symptoms like night sweats, the fever, muscle aches, fatigue, skin patches, chills, swollen lymph nodes, there may be sore throat and mouth ulcers. So these are the presenting signs and symptoms of HIV even. Very rarely, recurrent ulceration can be a possible sign of several serious diseases, and out of these, the symptomatic of these, however, technically not Aphthous ulcers may look like Aphthous ulcerations. So these ulcers, they may look like Aphthous ulcers, but they are not Aphthous ulcers. How we diagnose? We all know in most cases, especially when the condition is not recurrent, the diagnosis will be based around medical examination and can investigation of an individual's medical history. So You go deep into the history, you do the examination, you exclude other causes, and then you diagnose the patient has got Aphthous ulcers. A proper evaluation and diagnostic workup of recurrent ulceration is important due to its links to other more serious conditions such as celiac disease, inflammatory bowel disease like Crohn's disease, or conditions causing a weakened immune system such as HIV and AIDS. The diagnostic process may involve ruling out of these conditions through blood tests or less often using a gastroscopy or colonoscopy, possibly also obtaining tissue samples for biopsy. The course, the diagnostic workup will depend upon on the doctor's evaluation of the severity of individual's condition and presence of any other symptoms. So you individualize the workup to the patient. What are the complications? Although most mouth ulcers will clear up within 2 weeks, in very rare cases, they may become infected with bacteria. This usually only happens in severe cases where the ulceration area is extensive. In the case of secondary bacterial infection, an antibiotic mouthwash and a means of managing the pain and discomfort may be prescribed. In some cases, oral antibiotics may also be needed. What is the treatment? I said there is no cure for Aphthous ulcers, but there are ways to manage the symptoms. In the majority of cases, the ulcers will disappear. Without treatment and avoiding hard or irritating foods, applying cold substances to the affected area and if needed, using the numbing preparation like topical lidocaine or benzocaine, and these will be enough to manage the pain. So this is the commonly used medications which contains the lignocaine, menthol, and others to soothe the Aphthous ulcers. There is no cure for Aphthous ulcers, but I said that these are the different drugs which can be used. When further treatment is required, there are several possible options with the chosen route depending on a doctor's judgment of how well each may work. So it's your choice that you will prescribe these drugs to any person. The anti-inflammatory treatment, these are other drugs which the patient use even if not prescribed, and these are the over-the-counter topical anti-inflammatory pastes. They are applied directly to the problem area, and they are may be effective in managing the symptoms. The other treatments, they include topical or rarely oral steroids, silver nitrate, other local anesthetics, numbing agents, and nutritional supplements, which are very, very important. The antiseptic antibiotic treatment are also among the treatment of Aphthous ulcers, like containing chlorhexidine, and in rare cases, you may prescribe topical or oral antibiotics such as tetracycline or minocycline. Antiseptic or antibiotic treatment also needs these sprays. Key to success is that to avoid food that may trigger ulcerations in the individual's person. You focus on a healthy, balanced diet containing sufficient amount of nutrients and vitamins. And you maintain good dental hygiene and using a soft toothbrush to avoid irritation, reducing stress, and getting plenty of sleep. This is very, very important, the dental hygiene. The Aphthous ulcers prognosis is that they are generally non-serious and will go away without any particular treatment even. The ulcers that heal on their own within a few weeks are not an indication of oral cancer and are non-infectious. So this is very, very important, and you must counsel your patients. The ulcers, however, can be very painful and inconveniencing, especially if they are recurrent. So, dear colleagues, uh, today we discussed that what are the Aphthous ulcers, what are the types of Aphthous ulcers, the three types, what are the symptoms, and what are the signs of these, and what are the causes that results in causation of the Aphthous ulcers, how we diagnose these, and what are the complications of these, and then how we treat them, mostly the symptomatic treatment, and how we prevent them, and what is the prognosis of Aphthous ulcers. So with this, I end this presentation, and I thank you all. So we meet in another lecture, another topic. Till then, it's Khuda Hafiz.